Let's talk about ACL rehab and return to play times. The first is this one. I've seen this paper referenced by a lot of practitioners when discussing the need for players to wait 9 months before returning to sport. The authors concluded that returning to sport before 9 months after an ACL recon was associated with a 7-fold increased rate of sustaining a secondary injury. They used 5 tests to define if a player was ready to return or not, 2 strength and 3 hot tests. Now for me, these tests would be sufficient for a simple ankle sprain, but not an ACL reconstruction. Most published exit criteria have at least 25 tests in total to determine if somebody's ready to return to sport or not. And here is the biggest takeaway. Only 24% of the athletes passed the exit criteria before returning to sport. So not only was testing inadequate for return to sport following an ACL, but 76% did not even pass the exit criteria. Is it any wonder there was so many re-ruptures? So the headline for the paper is, if you return before 9 months, regardless of muscle function, you're 7 times more likely to sustain a new ACL injury. Whereas what this study actually shows is if you return to sport without achieving symmetrical muscle function, then you are equally at risk of sustaining a new ACL injury, regardless of the time you return. So on the evidence of this paper, I will continue to not have time post-surgery as part of my exit criteria, and will continue to use a task-based protocol whereby patients' function determines when they return to sport and not time.